is Eric. I'm here at RefinedMD, and I'm here to introduce you to lots of options that we have here for non-invasively sculpting bodies. This is a very popular treatment, and it's one that's requested very frequently in our office because we're going into spring and then going into summer. It's bikini season. I want to introduce you to somebody special in our office. Her name is Bella. She's our body sculpting specialist.
Hi everyone, I'm Bella and I'm the body treatment specialist here at RefinedMD.
And tell the viewers how long you've been with this and what your favorite treatments are.
I've been here for about, 3 years. How amazing. I learned a lot here working at Refined, and we have a lot of machines here in our office that are non-invasive that can help contour your body and give you some muscle strength and whatever you're looking to get out of the treatments.
What do you think most people come in asking for? What would you say?
Well, the new machine, which is the M-Scope Neo.
But what is that?
M-Scope Neo, it's going to help stimulate your muscle and give you a better core, and there is some fat cell reduction to it too.
God, that sounds like an awesome treatment. Maybe I could even use it.
Yeah, everyone's a candidate for it, just depending on what results you're looking to achieve.
I mean, both men and women?
Men, women, anyone, ages. I think my youngest patients are around 20, my oldest patients are around 70.
Now,
75.
is this the most popular treatment, or do you usually, do you ever pair this with other treatments you have?
Right now, so far, it is popular, but we do combine it just depending on what they want. So if you want to reduce the size, then we would do co-sculpting first, and then down the road do M-Sculpt to build the muscle. Or if you just want a stronger core, then M-Sculpt, because gyms are opening up again already, and people are like, I want to go back to the gym.
Got it. Now, there's another device you have there, just regular M-Sculpt, right?
Yes.
So when do you use M-Sculpt versus M-Sculpt Neo? How do you know?
That's a good question. Well, M-Scope Neo has radio frequency in it, so if they want to combine muscle strength and fat cell reduction, we would do M-Scope Neo. Someone who doesn't have much subcutaneous fat and just want to straighten their muscle, we would do the M-Scope, regular M-Scope.
Got it. What body parts do you typically see people coming in to treat?
Okay, so M-Scope is FDA approved for abdomen, glutes, thighs. We also have smaller applicators, but typically would be abdomen and glutes.
Right. What about arms? Can I treat my arms?
Yeah, you can definitely do that. We have the small applicators here, so you can do your triceps, biceps, and your calves.
Oh, even my legs?
Yeah.
Wow, that's awesome. Okay.
Yeah.
So what about other devices that you have in the office besides M-Sculpt?
We do have co-sculpting. We have Axillus radio frequency that's more for skin tightening.
Is that a big deal? Do people need their skin tightened?
Yeah. There's a lot of patients who are losing weight, so when they're losing the weight, then they're like, oh my gosh, my skin is appearing, so now they want to target their skin. And then you can't really treat your skin at the gym, so they come in here for skin tightening treatments.
I like that. You can't really treat your skin at the gym.
Yeah, unless you gain weight, then you fill up your skin with weight.
Uh-huh.
Yeah.
Uh-huh. So do any of these treatments help with stretch marks when people have had sudden weight loss?
Yeah, that's a good one. Well, typically for stretch marks, we would do some laser treatments just because stretch marks are very deep, so the lasers penetrate deeper than the body treatment. So it would be mostly laser profrags or microneedling.
Okay. So there are options.
There are options, yes. So we would always invite patients to come in so we can assess the area better and then recommend them to the best treatment plan for them.
That's good to know. So how would I start my journey if I wanted to come in for a body sculpting? Is it a consultation? Or
Yeah,
just get treatment?
When it's a body treatment consultation, you would meet with me first. I would assess your areas of concern and then see what you want to improve first and then create a better plan for you.
Mm-hmm. Is this something that you generally see results in a week, in 2 weeks?
Yeah,
How long does it
depending
take?
on the treatments. These are non-invasive treatments, so it is a process. It takes, depending on the treatments you do, it takes about 4 to 6 weeks. Co-sculpting is more about 2 to 3 months, depending on your treatment plan.
Mm-hmm.
But it is a process. So.
Sounds like I better get busy. It's already
Start now,
April.
please. I know, summer's around the corner.
Awesome. Well, I know we're going to be going over and spending some time in your clinic and having you show us some of the devices.
Yeah.
So I'm looking forward to seeing those in person, and hopefully you can give me a better idea of what a treatment is really like. Does
Yeah,
it
we
hurt?
do offer demos too. On the M-Scope, we can definitely
really?
offer a demo. Yes.
Awesome. So
You
you
can get a
have, is that
better-
part of the consultation process?
Yeah. On the M-Scope, that one you can try it out and get a better feeling of it. It's so hard to explain how it feels, because then what if I say something and it scares you? So I'd rather have you try it out and you get a better idea.
Mhm.
And then after
Totally
you
sense.
try it out, then you're like, oh yeah, I think it's not really targeting my muscle. I'd rather target my fat. So depending on what results you want.
Like, what's the typical age patient that comes in? Is it all over the map, or?
Yeah, it just depends.
Oh, look who's here, Dr. Swengel. Come on in.
Swengel.
Hey, how are you?
We're well. How are you?
Come on in, Doctor.
What are you talking about here?
Well, we're just having a little conversation about treatment expert, and we're having a little
Yes.
discussion about all the modalities that we have and how we can treat patients. So that's what we're talking about. Anything you wanted to add?
No, I just have to say that the M-Sculpt Neo, the new system we brought in, has resulted in a lot of very happy patients.
Yeah.
I think it's there's a niche for the right sort of person for that treatment, and
Yeah.
I think we still need to assess whether or not people have what I call the pinchable diet and exercise resistant fat that really needs to be addressed first.
Yeah.
But I always say everyone's got some love handles. There's a certain age where everyone's got them.
Yeah.
So how do you set these treatments that you have in your office apart from like liposuction or other more invasive treatments?
Well, it's exactly that. It's not as invasive. It's easier recovery. I think it's just for people who want immediate results and are willing to deal with the pain and discomfort of liposuction and potential uneven sort of removable fat. It's a great way to do it quickly, but it doesn't allow you to kind of contour and mold their body shape.
I've read questions on Real Self and other online forums, and people like always are talking about, hey, how much weight am I going to lose? And so how do you guys address that in the clinic when the patient comes in and says, I'm 25 pounds overweight, what do I expect to lose if I do these treatments that you're recommending?
What do you tell them, Bella?
Well, depending on the treatment options again, co-sculpting, depending. You got to do several treatments. Single treatments of co-sculpting, you get about 20 to 25% fat cell reduction. But I always like to tell them you have to diet and exercise on top of it as well.
But you said fat cell reduction, and I want to know like how many pounds am I going to lose? Because it's the scale that tells my story. I jump on it every morning and go like, whoa, now I'm at 170. So what am I going to get?
Well, I think the biggest thing is that the external fat that we kind of feel is the fat that makes us heavy really is not that heavy. The actual weight of our bodies is muscle mass, the denser fat in our guts, and bone, and water, of course.
Oh, yeah.
So the idea that somehow I'm going to lose my love handles and lose lots of weight, that's a joke. I think that, in fact, I've said that you should be doing your part to lose weight. If there's weight to be lost, if you feel that you're at your normal weight, you've been stable, then you will reduce visible fat, but you're not going to adjust your weight that much.
So, there was a patient that I spoke to of yours that came in the clinic, and she said that she was not feeling good about having her weight taken, but she said that you asked to take her weight and to record it. Why would you do that if it's not going to make a difference?
We just want to make sure patients are maintaining the same weight. We want to make sure they're not adding more weight on top of it, because if you're adding more weight, then you won't start to see your results. I mean,
Right.
You might feel different on the inside or something, but you won't visually see your
if someone is
results.
slowly gaining weight during these treatments, they're going to be sorely disappointed in the results, because we're still melting fat, but if you're building it up faster than we can melt it, you're not going to see the results.
Yeah.
I still remember the time we had two best friends forever come in, and we did side-by-side cool sculpting for them, and it was kind of an all-day event. And I remember I walked in at lunchtime, and there they were. They had ordered out pizza, and I said to them, "You are destined to fail on this project if this is how you're going to eat. You should be having a salad with no dressing." But I just think that you can't make this an excuse to.
Well, either that or just like pizza my heart, one slice at a time. Right?
That's it though.
Well, it's all about choosing, the amount of calories you're consuming to keep your weight down or lose weight.
So, yeah. So what do you guys think beyond M-Sculpt Neo, where are we going to go with non-invasive body treatments? Is there a point that the industry or the people supplying you guys with equipment will say, can't do anymore, you just have to surgically take it out? Or do you think there's some new exciting frontiers?
I could probably speak to that more than Bella, but
Yeah.
I think what we're seeing right now in a lot of technology is variations on a theme. And we're really looking at how do you deliver enough heat into the skin or freeze the fat to actually cause reduction of fat. So, every company is coming up with their version of either heating it or freezing it. And I think that's kind of where we are. Now, the one thing that certainly has come out recently is Quo, but that's more for cellulite. Kybella certainly works, but Kybella only is sold in little vials that
So-
would make it outrageously expensive to treat off the face.
I think you're telling me then, if I want to lose fat, I can do it 3 ways. You said I can freeze it, I can heat it, or I can kill it with chemicals, with like something like Kybella.
Right, or you can diet it off, or you can actually
Exercise.
have, or
Or
you
surgery.
can have it surgically removed.
Uh-huh.
Those are their 5 options. And I think you have to decide where you are in that spectrum.
Yeah. It's a good way.
You mentioned Quo. I've never heard of Quo. What is that?
Quo just came out, and Quo is a collagenase product that's actually derived from Clostridium histolyticum, a bacteria. And it's specifically breaks type 1 and 3 collagen fibers that cause the tethering of cellulite dimples.
Oh, it's
And-
for cellulite.
For cellulite,
Okay.
so it's not a fat reducer. It's actually
Okay.
it helps to contour the buttocks by releasing those bands that create cellulite dimples.
So how does it work? Is it?
It's an
so-
injectable form
It's an injectable.
that you just inject right down into the center of the cellulite dimple, and at 45 degrees north and south, and you literally while they're laying there face down, you see these dimples just disappear.
So are you seeing good results with your patients?
To date, we are. Yes, we are. But we've only had it in our hands for about 2 weeks, and you actually have to look at 3 treatments spaced about 3 weeks apart. So the whole treatment series is about a 6 weeks period. So we literally are just now going to be seeing the second wave of people coming in for their second treatment.
So what kind of, are there side effects? This sounds too good to be true to me.
No, it's amazing, and I've kind of said that having been known for doing Selfina, that I think it's just going to be a great replacement for Selfina, which is a more a traumatic, invasive treatment to literally with a little fine saw literally cut those bands underneath the skin. The biggest issue with Quo is bruising, and I say to people, you are going to bruise. Get ready. And the explanation there is not that we're injuring tissue, but as those fibrous bands break, then the fat around actually literally just is able to fall into the area that was now opened up through the breaking of that band. And the little venules that are kind of carefully suspended in those fat lobules, the venules break. And so you get this leakage that causes bruising. Usually by 2 or 3 weeks, it's pretty much gone, but it is going to happen.
Mm-hmm. So would you recommend this treatment for like men as well?
Well, men don't really have cellulite to speak of. It's basically women have these fibrosepta that are perpendicular to the skin, and men don't have those. So I've personally, I've never seen a man who has come in saying, treat my cellulite.
How does a treatment like this get priced in your practice? Like, can you give me any ranges, or is it based on how bad my cellulite is?
Yes, you've nailed it. It's based on
Really?
how many cellulite dimples you have, and how much we'll have to use. So I kind of call this a time and material sort of treatment. So for most people, they expect for a series of the 3 treatments to either from a low range of 2,500 up to a high range of about 3,500, which is a lot less than a lot of the other
Is that
treatments.
per treatment or for all 3?
That's for all 3.
Oh, that's very reasonable.
Yeah.
Mm-hmm.
You just have to be willing to do a lot of photography with us, because that helps us with the right kind of lighting to really see those dimples and
Now,
to
what
assess
about
your improvement.
dimples like on women's thighs, the part that you see beneath their bathing suit or beneath the miniskirt, are those treatable? The back of their thighs?
Well, to date, Quo has been specifically approved for dimpling on the buttocks and is not designed to treat laxity. And the issue is that laxity becomes more of an issue as you go down onto your lateral thighs. So if you just basically take your cellulite and just take your hand and pull up with your hands half an inch to an inch, and you're like, oh, it's gone. That's laxity. So the problem with breaking those bands when you already have laxity is you could actually make
Further
it worse, but you increase more laxity.
What do you think?
And of course, we're one of 30 offices in the country doing this treatment, and Quo, since it's new and it's FDA cleared for that area, they've really asked us to stay where it's indicated to make sure that we're giving results that they know will.
Well, that was going to be my next
happen.
question. When do you think, doctors are kind of cowboys and they like always do stuff that's like off-label, or they want to experiment, they're getting great results on the buttocks. What's going to make people be comfortable enough to try it elsewhere?
I think it's just time and experience. I mean, just for example, Kybella, which is the way we melt fat chemically, that was only indicated, and still is only indicated for submental fat. But we are now taking it and doing what I call the horse yoke of fat that often...
Oh, for jawline contouring?
For jawline contouring. And also to get rid of the pre-jowl fat, where people just start to get this bulge of fat right here. It works. But initially, we only kept it to here, but then began realizing that there were other issues that we were exposing just by treating only here.
So, question, Bella, have you ever treated Dr. Swengel with any of these devices we have here?
Yeah, I've done M-Sculpt on him to his arms, abdomen.
And
Really? Oh.
And M-Sculpt Neo.
Both
I've got that little bit of padding here, so if I'm coming in and saying, help me to tighten and rip my abs a little bit more, I might as well go after the fat too.
Yes.
Now, if you got someone where you're just like, there's no fat to be had, then pure, the original M-Sculpt is fine. And I think you did cool sculpting on me, didn't you?
No, not me.
Somebody
So,
did.
you've had cool sculpting before?
Yeah, I've had about 9 applicators applied, and I have to honestly tell, I just lost all this kind of lower belly and love handles, and they've never come back. I went from a 34-inch waist to a 31, 32, and it's never changed.
So, Bella, wow, well, this is really exciting. I, for one, am looking forward to seeing some of these devices, because right now it's kind of a mishmash in my brain. I've heard you guys talk about M-Sculpt, Vanquish, Neo, whatever. So let's go over to the clinic and let's see what you got, and you guys can show me the equipment.
Well, it's also, I think you're absolutely right that there's a lot of great technology, and it's a matter of customizing the fit for each person. And I think that's the real key to making people happy with their results.
Yeah, that's why we always invite patients rather to come in for an in-person consult, so that we can definitely see what we will be working with.
Yeah.
Awesome. Well, thank you guys. Let's go over.
So we are allowed to pick the settings on the device. The hottest it gets is up to 43 degrees Celsius. That's the hottest. So if we're going after skin laxity, we want to maintain the heat. But if you want some fat cell reduction, then we pick the settings where it's somewhat warm and then some cold. So the cold is going to target the fat cells, and the heat is going to target to help connect the connective tissues for skin tightening.
Interesting. So, and you mentioned this is more for face and neck?
This is for face and neck, yeah. So this one just has heat. We don't really want to put any cold in it.
What about this bad boy? This looks like a big piece of equipment.
Yeah, so that one can cover the full body just depending on what area you want to treat. So stomach, thighs.
How long does the treatment take if you're treating, let's say, just somebody's stomach?
Usually it says on the settings 15 minutes, but I like to give it about 20 minutes because it takes about 5 minutes for the skin to warm up. And then we want to maintain the heat for about 10 to 15 minutes, at least hot enough.
So once you're done with that 15 or 20 minutes, is that it?
Yeah, you can go back to our normal activities. What I like to combine it with is Zimmer.
Is it the Z-Wave device?
Yes, it's a Z-Wave device, so it works with pulses. I just like to massage the area just to, if they're doing fat cell reduction, for the lymphatic drainage.
Let's get to that one in a few minutes.
Yeah, it's
Tell me
already
about this one. What
this one's cool sculpting, so this one works with cold.
This works
So if you want to contour and reduce the size of the pockets of fat that you don't like, then we would do cool sculpting.
Got it. And I see it looks like you have another machine.
Yeah, so we have two. So patients who want to do arms and flanks, we can do those at the same time. Stomach, typically we do one at a time. So just depending on...
Is that what they call dual sculpting?
Yeah, simultaneously or...
So you have these two machines?
Yeah, so we have two machines. Well, we have 4 in our office. In the other room, we have 2 again too. So we can do cool sculpting is really easy. If we get 2 patients who want to do cool sculpting at the same time, we can definitely treat them.
What treatments go well with cool sculpting? Like, are there things that you'd pair it with?
Yeah, well, we can combine it. So if patients want to shrink the size, then we would do co-sculpting, and then down the road, if they want to do some M-sculpt to build muscle, then we would do that afterwards. We want to wait at least 30 days in between to start the new treatment, just because it takes 30 days for the fat cells to flush out of the system. It takes 2 to 3 months to get your results because it's going to be contouring your body, but 30 days to start a new treatment.
I gotta, what are all these things in this folder here? Like, what are these?
Oh yeah, these are our templates. So this is how we go based off what applicator patients are candidates for. So the bigger you are, we would use the biggest one to cover a wider area. The smaller one typically.
So that's just how you plan the treatment?
Yeah, this is how we plan it.
Okay.
We use these to do our marks. We have to use Sharpie just so that we can go based off our marks. I like to also draw them just so that patients can see what's going to be getting treated.
Oh.
Because patients always think, oh, it's going to grab a big area, but we'd rather just do the marks so they can see how much the applicators can grab.
So this works.
Yeah, so definitely works. It's been around for about 5 years or more. Also with the clinical trials, they have done like over 100, and I've been doing this for about 3 years already, and patients are very satisfied. They always come back wanting to treat more areas. So.
Oh, it sounds like that's a winner treatment.
Yeah, I personally love co-sculpting.
Now I see you have a little like camera system here in the corner.
Yeah, so we definitely take pictures before and after. Sometimes we can use them for marketing if patients allow us to use it, but we use it for our medical record purposes. We want to make sure their treatments are working well, and we just record everything that goes on in there.
Is this a special camera? It looks a little.
Yeah, so this one is called Quantificare. What it does, it's a 3D camera. It creates a 3D module of the patient's body.
Oh.
So we're able to see the full 360 degrees.
That's pretty cool.
Yeah, it's pretty amazing.
How about this device?
This is our new bad boy in our office, the M-Scope Neo. Came out in December 2020.
Mm-hmm.
So this one is the one that has radio frequency and electromagnetic. So the radio frequency is the heat. It's going to target the fat cells. Electromagnetic is going to stimulate the muscle and give you that muscle strength.
That sounds like a great combination.
Yeah, it's a good combination. We also have Vanquish. It's not in this room specifically, but Vanquish is radio frequency. So the Vanquish and M-Scope put together makes M-Scope Neo. That makes any sense.
Yeah, that does make sense.
Yeah.
So, like a typical patient, like, is it just one treatment of this?
M-Scope that is intended to do 4 treatments to get the full results.
So what kind of results could somebody expect?
Yeah, so typically with M-Scope you can get about up to 2 inches of fat cell reduction. You will definitely get some muscle strength. A lot of patients always tell me that they notice their core is better when they go to the gym or when they're working out. So
one question I have is, like, if you reduce the fat, but then if the muscle grows, do you still get like a net reduction, or?
it's very hard to notice the reduction overall, but you could start to feel your muscle strength when you touch the area.
Got it. So I see 2 things hanging off the back of this machine.
Yeah, so since this one has radio frequency, we want to make sure the heat is hovering over the full abdomen. So someone who's big like me or even bigger, we would typically place 2 paddles on them. Someone who's a little thinner or smaller, we just typically place 1, making sure it covers the full abdomen.
So would I be a candidate for one?
So typically, yeah, we would be able to fit 2 paddles on your abdomen. As you can see here, it comes with the strap. So we strap up the patient, then we tug in the applicators, and then you just lie there. You don't have to hold them.
Nice.
So that,
Nice.
Yeah.
So what about this device here?
Yeah, so this is our Zimmer. This is the one that I mentioned. We typically combine it with co-sculpting, Exilis, Vanquish. It works with pulses, so it helps massage the area that we just treated for the lymphatic drainage and just smooth out the area.
Oh, you guys have a lot of equipment.
We have a lot of
Usually like decked out like this in the room all together, or?
Sometimes when patients are doing several areas, we have a lot of machines in the office. Like I mentioned, they do go out in the patio to get some fresh air. And yeah.
Great. Well, it looks like you can kind of do it all here at RefinedMD.
Yeah,
nice
definitely.
to see.
We have a lot.
So thank you for sharing everything today with us.
Yeah, of course.
Okay. So what does this person show? So this before and
Yeah,
after
so
shows?
patient came in looking like this. She didn't like the appearance of her lower abdomen, so they targeted it with a big applicator to cover this full area. After about 2 months, she achieved this result, but she still wasn't happy by the pockets of fat that she notices. So then they did a couple more with the smaller ones just to make sure to cover those pockets, and then after about 2 more months, she achieved that.
So that's a pretty impressive
Really
result.
good,
I like
yeah.
that.
So just depending on how you want to look, if you want to look really slim down and flat, we can achieve that.
How about back here? There was one I wanted to ask you about. So like this is really impressive to go from here to here. What did she do?
So it looks like this patient came in with this. She doesn't like her lower abdomen and flanks. So they went after her lower abdomen and the flanks as well to achieve the
So they did
reduction.
6 applicators.
So yeah, so they did 2 to her lower abdomen, 2 to the flanks, and then they also covered like midsection of the abdomen.
Now it says 3 weeks after third set, so they actually did 18, 18 applicators.
Yeah, so
Wow, that's a big
they
treatment.
did several cycles. So depending
nice.
on patients' bodies, we can determine how many cycles they would require.
It's a really good result.
Yeah, really good.
Well, thank you for sharing that.
Yeah, absolutely.
Hey, I'm back here with Dr. Swengel, and I just had a few kind of lingering questions about some of your body treatments. We talked about Vanquish earlier. Like, who's Vanquish good for, and like, how do you use it in the practice?
Well, Vanquish is radio frequency, and it's designed to be a treatment where there's no grounds or attachments to it. Actually, the energies crisscross through your soft tissue by wrapping this system around your abdomen. I find that Vanquish, in my opinion, works really well for people who have circumferential fat that's really fibrotic. Fat that you just basically can't pinch it up to get it into an applicator and cool sculpting. So it's often used in that individual to get that fat to soften up, to diminish somewhat, and I think the heat actually helps with the fibrotic quality of that tissue.
Interesting. I mean, do people get any skin tightening as a result of the Vanquish?
Well, it can be used for that. It all depends on how you position that huge panel that goes around your belly. The further away you place it, the more you're putting heat in the very superficial parts of the skin, so you can get some skin tightening. When you get it really close, then it goes deeper into the skin, and that's when you get fat destruction.
Mm-hmm. Let's touch on something earlier we were talking about when I was sitting down with you about, I know you have surgical options or more invasive options, like you mentioned Selfina for dealing with cellulite, but you also have like the non-invasive new injectable called Quo. How do you differentiate when you use one versus the other?
Well, actually, they all work. I think it all depends on the amount of downtime you want, and also kind of just the long-term results. There actually are lasers too, that do the same thing.
For cellulite?
Yeah, I think one's actually called cellulase, and we never chose to do it. But what that is, there's a tip that goes into the skin, and basically you're using just high energy heat to try to lyse that band. With Selfina, you're using a very sharp small blade where you puncture a hole in the skin and aim for the center of your cellulite dimple, and actually then with that blade you're basically cutting through that band. Quo, on the other hand, actually just digests that band. So I think we've gone from the most kind of severe and long-term sort of recovery to a mechanical one of Selfina, which has a lot of bruising and drainage and recovery, to Quo, which is a very simple injectable product.
So that kind of begs the question when you're talking about like how you're destroying those bands. Which one lasts longer? Which one is like proof? Or are there any studies showing 1 year, 2 year, 5 year durations?
Well, they all actually had some FDA clearance for the studies, and basically once you lyse the band, that band is gone.
How about other bands though?
Well, but that's the thing, is that in women the bands are very perpendicular to the skin, so they can start tethering down again. But it's usually not the same band. You're basically you're lysing bands, and then also you're cutting them, or digesting them, and you're basically looking for just kind of the buttocks to remain smoother and more supple.
So are you pretty confident that people are going to be happy long term with either of the treatments you offer in your office, either Selfina or Quo?
Yes. I think the big thing for me as the operator of the equipment is Quo is a lot simpler and easier for me to actually use the system to address your cellulite than. So I think that this office, without a doubt, will be basically drifting almost predominantly into Quo as a way to treat cellulite.
Wow. Well, that's good information. Don't think we have anything else to ask you, but thank you for joining us today.
No, thank you.